So our case is Mr. Jones, age 74. He's a male. I have an ABG ordered for a history and diagnosis of pneumonia. Patient entered the ED in respiratory distress with a respiratory rate of 25 and labored. SATs are 88% on 6-liter nasal cannula. His heart rate is 140 and his blood pressure is 170 over 120. So first, before I do anything, I'm going to go ahead and make sure that I have an order for an ABG, which I do, and then check the chart for any indications, contraindications, and allergies. Once I do that, I'm going to go ahead and gather my ABG kit, any other equipment I would need before I enter the room, and then wash my hands and put on gloves. Once I have gloves in my kit, I'm just going to make sure that I have everything I need in the kit. So I've got my needle, my syringe, my cap, I've got a band-aid, gauze, a label, and an antiseptic wipe to clean them off with, so we're good there. I'm going to go ahead, enter the room, introduce myself to the patient, and get 2 patient identifiers to make sure I'm with the right patient before I do anything else. So I'm going to be like, hi, Mr. Jones, my name is Dee, I'm with Respiratory. We have an ABG ordered here. Can I have your name and date of birth?
Mr. Jones, 2/1/1968.
All right, and once I confirmed I'm with the right patient, I can go ahead and start. First thing is to site determination, so I'm going to go ahead and feel for a pulse. Then once I have a site, I'm going to go ahead and do an Allen's test. So I just need you to close and open a fist 3 times for me. And they have a positive Allen's test, so I can go ahead and start. Now my first step would be to go ahead and get everything prepared so that this stick can just be an easy one too. So I'm going to go ahead and make sure that my needle is on my syringe, that it's open to at least 1.5 or maybe 2 cc's. Put that to the side. Get my gauze and band-aid ready. I'm going to go ahead and fill out the label for his ABG with his name, vent settings, temperature, things like that. Get his band-aid ready to go so we don't have to wait once he actually does start bleeding. And then clean the area. Now once I clean the area, I am ready to go. I'm going to go ahead and uncap the needle. I'm going to make sure that the bevel is up and at a 45-degree angle. Just a little pinch. 1, 2, 3. And then I'm going to cap needle, shake my sample while I hold pressure for 5 minutes. And once the 5 minutes is over, I'm going to make sure he's no longer bleeding. Put my syringe in the ice bag and put a band-aid on. Okay. Make sure that's nice and tight so that he doesn't have any chance of bleeding. I'm going to go ahead, get this to the lab so that they can do the ABG measurements. I'm going to check in with Mr. Jones, make sure he's okay for me to leave before I do so. I'm going to go ahead and take the needle, put it in the sharps container, get all of my trash and equipment out of the room, wash my hands, and then go ahead and get those results read. So the results are as follows. His pH is 7.29, which is low. His PaCO2 is 60, which is high. His PaO2 is 45, which is very low. And then his bicarb is 28, which is high. So that's partially compensated respiratory acidosis. I'm going to go ahead and chart the following, let his doctor know, and then his doctor will discuss with him any critical values and what his treatment plan will be as follows.